right, I'm here in Mobile, Alabama at the Battle Renaissance Hotel. This is where we're staying for the night. The weather has been kind of crummy. We finally got it to stop raining here for a second. I'm gonna move inside so it's a little bit more quiet so you can hear me a little bit better, but this is where we're at. All right, the lighting is gonna be a little bit weird for this one, but we are here in the lobby of the Battle House Renaissance Hotel. This place is absolutely incredible. Super awesome hotel. Around it with the family. Their pool is incredible. They've got an outdoor tennis court in a hotel, which for those who follow the channel, you know I'm a tennis player. This is so cool, but you're not here for that. You are here to learn how Medicare works in Alabama. Alabama, you're a pretty standard state when we're talking about things related to both supplement plans and advantage plans. Let's start with the supplement plan side of the conversation first and your rates. So nationally, for a 65-year-old, if you were trying to go on a supplement plan G, the average is $150 per person per month. Here in Alabama, the average is $140. Now again, you'll find plans that are higher and lower, but the average is $140, so you're a little bit lower than the national average. For a plan N, the national average is $120 per person per month. For a 65-year-old, here in Alabama, it's $115. So again, slightly lower than the national average. You are an attained age state, and remember, there are three ways that supplement plans can be written here. The first is issue age. It's based on the age when you first get Medicare. The second is community rated. It's not based on your age, it's based on the community. And the third is attained age, and it's based on the age that you have attained, meaning that when you go on Medicare is one thing, but once you're on Medicare and you have a birthday, you've attained a new age, and you can see a bump because you've attained a new age. Throw on top of that the increase that could come because of just the annual rate increases that insurance companies throw in for rising healthcare costs and inflation. You could see up to 2 increases per year with attained age plans. Now, attained age plans are by far the most common in the United States, and the positive about them is that they start at a lower rate than the others typically. So that is kind of the pros and cons of attained age plans. With the already low rates of the supplement plans here, there are even more opportunities for further discounts, and I'll name off a few here. So there's a discount available if you just have somebody who lives in your house. It's called a roommate discount, and some insurance companies are willing to provide that. Another discount is called a household or multi-insured discount. This is where you and somebody in your house are with the same insurance company. So for example, you and your spouse both have the same supplement plan insurance company for your plans, and they'll give you a discount for that. Another discount is called a wearable discount. So if you're willing to wear a smartwatch like a Fitbit, a Garmin, or an iWatch, and connect that with the insurance company, then they can see that you're active and exercising, then they're willing to give you a discount for that. And then lastly, there are discounts available if you're willing to pay your premiums for the full year up front rather than month to month. So there are several opportunities here to take that already low supplement plan rates and drop them even lower. And this is why we're always talking about use an independent agent who's licensed and familiar with your area to help you get on these Medicare plans, because they can shop the plans to not only find you low rates, but then they can also know the differences between these insurance companies that are offering these discounts to drive them even lower. It never costs you anything to use an agent. Doesn't even mean you have to use us. Just use an independent agent who can help you with this and get you signed up for these plans. As I mentioned before, you kind of follow the standard rules nationally. So if you're wanting to switch from one supplement plan to another, you would need to do so by going through medical underwriting. This is where you answer medical questions. If you have good health, you are approved. If you have poor health, you could either be charged more or denied flat out. So that's the tricky part here, is there aren't any special rules to grant you options to switch more freely. When we talk about the supplement plan penetration rate, that's how many people are taking a supplement plan of any letter versus the other options like an Advantage plan or Original Medicare only or other options. Now, nationally, the plan penetration rate is 21%. Here in Alabama, it is 15.4%. That is the 6th lowest in the country. So your penetration rate here from a supplement plan perspective is less. Fewer people are picking supplement plans. That's not me telling you that you shouldn't take a supplement plan. It's just what the numbers are showing here in Alabama. The last thing to cover here when we're talking about supplement plans would be for those who qualify for Medicare before 65. So this is because you are either disabled, you have ALS, commonly known as Lou Gehrig's disease, or end-stage renal disease, ESRD, or kidney failure where you require dialysis to stay alive. So you can qualify for Medicare before 65 if any of those apply. And in most states, there isn't a lot of protection for those who qualify for Medicare pre-65, meaning from a supplement plan perspective, you either have no supplement plan options or you have very limited letters. And then with those letters, they're typically a lot more expensive. In Alabama, you kind of fall into that. You don't have options really for pre-65, and the options that do exist are incredibly expensive. Let's move now to the Advantage plan side of the conversation. And again, we're looking at pretty standard stuff here in Alabama, so you cannot switch Advantage plans back to Original Medicare and supplement plans easily, with the exception of your trial rights. So when we talk about trial rights, there are two ways to take advantage of them. The first is if you go on Medicare when you turn 65 and you pick an Advantage plan first. And this has to be around your 65th birthday. It's not if you take Medicare after 65, it's your 65th birthday. In this case, you have a chance to try an Advantage plan for 12 months. And if within those 12 months you want to switch back to original Medicare and a supplement plan, you can do so without medical underwriting and without the fear of getting denied. The second way to take advantage of a trial right is if you go on Medicare, and it doesn't matter what age this time. So anytime you go on Medicare for the first time and you choose a supplement plan first, if that's the case, and at some point you want to switch and try out an Advantage plan, you can switch off of the supplement plan to an Advantage plan, and then you have a 12-month window to try that Advantage plan to where you could switch back to your supplement plan without the need for medical underwriting and without the fear of getting denied. Outside of these trial rights, you're looking at either needing a special election period, and the most common are you've moved out of your coverage area or the Advantage plan that is offered to you is withdrawn from the area. If either of those happen, you can jump on a supplement plan with no medical underwriting, or you would have to go through medical underwriting. So again, you're on an Advantage plan, you want to get back to original Medicare and a supplement plan, you would have to go through the medical questions. And for those who are in poor health, that's where you could be denied. And again, that's kind of the reason why people are going to a supplement plan is something has gone wrong and now they want to get onto the additional coverage of a supplement plan. So those are kind of your options here to be aware of. When we talk about Advantage plans in general, in your more populated areas, you typically have more competition and more insurance companies vying for your business there. So you typically see stronger Advantage plans in more metropolitan or larger city areas. And the same thing holds true here. Now, nationally, the maximum out-of-pocket refers to the number that is your maximum risk in a given year on an Advantage plan that you would need to pay if everything goes wrong. Anything above that number, once you hit it, the insurance company takes care of the rest. Now, nationally, the average is $5,000 for Advantage plans. Here in Alabama, the average is $5,400. So you're a little bit higher than the national average on the maximum out-of-pocket averages. But again, this is an average, so you will have plans that are higher than that and plans that are lower than that. Nationally, when we talk about the Advantage plan penetration rate, it is 50%, but here in Alabama, it is 58%. That is the fourth highest in the country. So you have more people here in Alabama electing to go with Advantage plans. Again, this is not me telling you that you should or shouldn't go with an Advantage plan. Those are just the numbers here in Alabama. And again, another plug for why you should always use an independent agent. Make sure that they can compare the Advantage plans that are available to you to make sure the max out-of-pocket is what you want, plus your providers and the facilities that you want to see are in network, and that you're getting the benefits that you need there. Again, it doesn't have to be us. If you would like our help with this, I do have partners who are licensed and familiar with the plans here in Alabama. My email is in the description of this video. We'd be more than happy to help you. Now, I like to throw in secret keywords at the end of these videos to make sure that you've made it to. And that way, if you put the keywords in the comments, I can take them a little bit more seriously as I know you've watched the full video. So when I think of Alabama, I think of Forrest Gump. So the secret keyword for this video is any Tom Hanks movie. If you refer to any Tom Hanks movie in the comments, then I'll know. That'll be between you and me, our little secret that you've made it this far. And if you haven't subscribed already, please do so. It helps more than you know. And I will see you in the next video.